Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, with an emphasis on endocrine, diabetes, and metabolism. Let's get started with question number 5. For the following case, these findings most likely suggest impaired development of which of the following embryonic structures? A. Anterior neuropore. B. Foramen cecum. C. Rathke pouch. D. Second pharyngeal cleft. E. Third pharyngeal pouch. The case scenario is: a 1-week-old boy is brought to the emergency department with poor feeding, lethargy, and unusual muscle movements involving the left thumb and hand over the last 2 days. The patient's mother had appropriate prenatal care, a normal pregnancy, and took no medications other than prenatal vitamins. The infant's vital signs are normal, but unusual flexion of the left wrist and thumb and extension of the fingers are observed with cuff blood pressure measurement. Physical examination reveals a hypoplastic mandible, low-set ears, bifid uvula, and cleft palate. A chest X-ray reveals decreased soft tissue attenuation in the right anterior mediastinum. The question is: these findings most likely suggest impaired development of which of the following embryonic structures? Your options are: A. Anterior neuropore. B. Foramen cecum. C. Rathke pouch. D. Second pharyngeal cleft. E. Third pharyngeal pouch. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is E, which is third pharyngeal pouch. This question is designed with the focus to assess your ability to apply foundational science concepts. Microdeletion of chromosomal 22 underlies the spectrum of physical features seen in DiGeorge syndrome. Embryologically, the neural crest fails to migrate into the derivatives of the third pharyngeal pouches, which will affect inferior parathyroid and thymus. It also failed to migrate into the derivative of fourth pharyngeal pouches, which is superior parathyroid. The consequent parathyroid and thymic hypoplasia results in hypocalcemia and T-cell deficiency, respectively. The hypocalcemia in DiGeorge syndrome leads to increased neuromuscular excitability, which manifests as tetany, carpopedal spasms, or seizures. Tapping on the facial nerve usually elicits twitching of the nose and lips called Chvostek sign, and inflation of the blood pressure cuff leads to carpal spasm called Trousseau sign, as is seen in our patient. Normally, the thymic shadow is visible on a newborn's X-ray. Its absence reflects thymic hypoplasia, which leads to T-cell dysfunction and results in recurrent viral, fungal, and protozoan infections. Conotruncal cardiac anomalies, like interrupted aortic arch truncus arteriosus, may also result from failure of neural crest migration. If there is additional involvement of the first and second pharyngeal or branchial pouches, patients with DiGeorge syndrome may have features such as hypertelorism, short palpebral fissures, micrognathia, bifid uvula, and cleft palate. If you choose any option other than E, you are wrong. Let's briefly discuss the other options. Choice A is wrong because failure of the anterior neuropore to close leads to neural tube defects such as anencephaly. Neural tube defects can be prevented with maternal folic acid supplementation. Choice B is wrong because the foramen cecum is a depression on the tongue that represents the embryological remnant of the superior end of the obliterated thyroglossal duct. A persistent duct results in a thyroglossal cyst that presents as a midline neck mass. Choice C is wrong because the Rathke pouch represents an invaginated oral ectoderm that eventually develops into the anterior pituitary. Craniopharyngiomas arise from remnants of this pouch and can result in hypopituitarism, hydrocephalus, and diabetes insipidus, but not hypocalcemia. Choice D is wrong because the second pharyngeal cleft, also called second pharyngeal groove, is normally obliterated in utero. Persistence leads to a branchial cleft cyst between the angle of the mandible and sternocleidomastoid muscle. Your take-home message from this question is that DiGeorge syndrome results from maldevelopment of the third pharyngeal pouches, which will form the inferior parathyroid and thymus, and fourth pharyngeal pouches, which is going to form the superior parathyroid. Subsequent parathyroid and thymic hypoplasia results in hypocalcemia and T-cell deficiency. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Recall that comprehension is essential for advancement. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.